Hello and welcome to this Google Plus Hangout, the Youth Voices Let's Talk About Adolescent Health. My name is Diane Fender and I'm the Vice President of a global network called Girls Globe. We are a network of young people who are raising awareness about the rights and health of women and girls around the world. I'm also joined by my colleague Elizabeth Epstein, who will be curating social media content during this hangout.
Sorry, quick note. If you have any questions at any time during the hangout, feel free to ask on Twitter to Girls Globe and use the hashtag #CommitToDeliver, and I will pose as many questions as we can to our panelists.
So today we're talking about the renewed global strategy for women's, children's, and adolescent health. This is to be launched in September 2015 and is a roadmap for ending all preventable deaths of women, children, and adolescents by 2030. This builds upon the 2010 to 2015 global strategy for women's and children's health that was launched by the UN Secretary General. The Partnership for Maternal, Newborn, and Child's Health has led several consultative processes to engage both youth and other stakeholders in the discussion around essential priorities as they relate to the renewed strategy. All of this information will be curated together in summary reports that will inform the renewed strategy. So today we have an amazing group of panelists and the exciting opportunity to explore current priorities and have an interactive discussion with youth and thought leaders about the way forward. As Elizabeth said, we want to hear from you as well. So those of you that are watching live, we want you to type your questions in the comment box or tweet to #CommitToDeliver, because we will actually ask some of your questions to the panelists during this hangout. So I want to go ahead and let our panelists introduce themselves and get this hangout underway. So if we can start with Cecilia, if you'll introduce yourself and tell us a little bit about what you do.
Hello everybody, thank you for joining this hangout. Well, my name is Cecilia Garcia. I am the Executive Director and Gender Program Director of a Youth for Youth organization in Mexico City. I am also involved with the Young Leaders Program of a global advocacy organization known as Women Deliver. And I recently joined the efforts of the Partnership for Maternal, Newborn, and Child Health, better known as PMNCH, who is also very involved in conducting this consultation process to update the global strategy. So that's me, from Mexico.
Thank you, Cecilia. Patrick, if you want to go ahead and introduce yourself and tell us a little bit about what you do.
Thank you very much. I'd like to welcome everyone. My name is Patrick Mwesigye. I'm born and raised from Uganda. I work with an organization called Uganda Youth and Adolescent Health Forum, which is a grassroots youth-led health advocacy organization. I'm also currently acting as the coordinator of the African Youth and Adolescent Health Forum on Population and Development, which is a youth movement supported by UNFPA, very, very active in Africa. And I'm also the national chairperson. I'm the chairperson of the National Task Force of the Young People Self-Coordinating Entity in the National HIV and AIDS Response back in my country in Uganda. Yeah, and I'm a very, very committed and active youth advocate on sexual reproductive health and rights. Yeah, thanks.
Thank you so much, Patrick. And we have Laura here. Laura, if you just want to introduce yourself and tell us what you do. Laura, I think you need to unmute yourself.
My name is Laura Lasky, and I work at the UN agency, United Nations agency, called United Nations Fund for Population Activities, known as UNFPA. And what I do there is I am the director of the program on adolescents, that look at adolescent health, among other things. And I also am the director of the Sexual and Reproductive Health program here in UNFPA. The organization headquarters is in New York, so I'm right now in New York, although I am from Argentina.
Thank you so much, Laura. Well, we are excited to get this amazing panel underway. And the first question I want to ask is actually to Patrick and Cecilia. And I would like to ask you all, as the new global strategy is being shaped, what do you see as the main priorities for improving adolescent health? Why don't we go to Cecilia first?
Thank you very much, Diane. First of all, I would like to say that it is very important that this new strategy is taking into account the importance of including adolescent health as a priority for the, not only for the strategy, but also for the new development agenda that is being discussed right now in the UN and amongst different state members, the state members that are part of the UN system. Well, the UN, sorry. And first of all, I think I would say that it is very important to acknowledge that adolescents and as a population and as people are right holders, and that is very, very important when we think about developing strategies, policies, laws that address their needs and specifically their health needs. So that's one thing we need to take into account. And the other thing is understanding the different social and economic and political determinants of their health. And in that sense, even though we have different issues that we want to address whenever we talk about adolescent health, sexual and reproductive health of adolescents continues to be an issue that is sometimes overlooked, that is still surrounded by stigma and discrimination, and that has not been effectively addressed by policies within countries, especially whenever we talk about developing countries. So, I mean, those are some things that we really need to look at and discuss further. I mean, I think we're going to talk a little bit further about this during this hangout, but those are the two things that I would like to raise right now. Thank you. Patrick.
Okay, and unmute. Oh, well, yeah. Thank you. So I think and this is something I tweeted at some point, that I don't think there is any strategy, intervention, or program addressing maternal and child health issues that would work, especially in the developing world, when it does not address adolescent health issues, because they are more critical. I mean, for example, back in Africa, majority of our countries have their populations are largely and predominantly, young people, and these are adolescents. These are young people below 30 years. So, definitely, when you're planning, there's no doubt that you must take into account the adolescents or the young people themselves. So I'm glad, and I think I'm very, very happy that PMNCH and the rest of the global community are thinking it loud and important that we need to add adolescents as a key component or constituency in the global strategy. And of course, to me, there are key. Of course, there are so many issues that affect adolescents, but then we might need to ask to zero on to addressing the root causes, as opposed to the effect, as opposed to addressing the effects of adolescent health challenges. And I think the key priority areas that every young person would tell you if you ask them would be one. I think one would be access to sexuality education and information. I think that's very, very key. I think the strategy must put in place a clear intervention and strategy to ensure that young people have access to sexuality education and information at school. The strategy also must be devised for the young people who are not at school, because like in most of the developing countries, we have so many young people who drop out of school at 12, at 13, at 14. So if you only leave it to the school going, then you will leave out those who are not going to school. Then of course, when there's a lot of, when young people know about their sexual rights, when they know about information on their rights and all that, they'll want to, it will create demand, so they want to go and access services. So meaning that we must put in place that the strategy must address issues of access to youth-friendly services and information, and rather youth-friendly services. And this must be integrated into the general health sector, not only, you don't need to have this as individual things, but it must be integrated holistically. Then access to family planning services and commodities. There are so many myths and misconceptions about family planning services, and that is why very many young people will tell you these contraceptives are not good. They will affect our fertility. They will do what. So we must take adequate attention into making young people understand why we advise them to use contraceptives, and before we even think about access, because there is access, but when young people are not really convinced, then it also becomes a problem. Yeah, but also making them accessible, affordable, addressing the question of age is very, very critical, because like for example in my country, if I'm younger than 18, there is no health worker at a public health facility who will give me a family planning service. But I'm sexually active, and I stand a chance of being pregnant if I'm a girl, but I'll go to a health worker. I don't want to give birth, but they will deny me the services. So probably I think the strategy also needs to look into issues of age consent and give young people, a chance or a priority, to access family planning services and information. Yeah. Then maybe the other thing that I think is critical is the health workers at the health facilities. You note that the health workers, some of them do not have any, I don't know what to call it, but their attitudes are so negative to young people. Themselves actually chase away the young people from the facility. So I think countries must devise a strategy of integrating probably adolescent health in their education curriculum for the health workers. If not, if they're like refresher courses probably supported by WHO or UNFP or what, they should emphasize that as a critical point, that health workers are in position to address and respond to the needs of adolescents. Yeah, I think I can give that for now.
Thank you, Patrick and Cecilia, for just explaining what you think the priorities are right now. I think we're all here because we agree that young people need to be a part of this conversation. Now, Laura, you have recently been a part of pulling together focus groups of young people to speak into this process. What opportunities has this given to you? Can you explain a little bit more about what you're doing there?
Yeah, thank you, and thank you for the invitation. This is a fantastic time for including adolescents in this global agenda, whether through the Every Woman, Every Child, that now probably will call Every Woman, Every Child, Every Adolescent, or through the Sustainable Development Goals discussion. So we are at an amazing turning point. The opportunity, I have been coordinating and consulting with experts and including young people about developing a paper that will identify the priorities on adolescent health to be included in this global strategy. So the opportunities have been, we convene a consultation with experts and young people here in New York, and we have convened a consultation in Delhi, but now we are finalizing that paper. But that paper will be online. It will be posted online, I think it's next week, on the 25th or 26th of March, and it will be there for comments for everybody until I think the end of the first week of April. So you will have like 2 weeks to put the comments of that paper and have your voice heard about what you think should be included in this strategy.
Laura, that's really great and encouraging to see that there are processes that are in place that are really attempting to include adolescents in this conversation to improve adolescent health in the renewed global strategy and in the post-2015 agenda. I want to turn it over to Elizabeth now to see if we have any questions from our audience.
Thanks, Diane, and what a great conversation so far. I'm excited to pull some of these questions from the audience to get your questions out there and have your questions answered. So the first one that we're going to ask is from @_GYCA_, and they say, how will strategy involve young people from marginalized groups in decision making in the post-2015 agenda and the global strategy?
Cecilia, do you want to take that question?
Here, let me repeat it. It's how will strategy, the global strategy, involve young people from marginalized groups in decision making going forward?
Very, very good question. Thank you, Elizabeth, for sharing. This is indeed a challenge. I mean, right now we are in a consultation process that has different phases and that is really trying hard to reach these populations through the organizations that are working at the grassroots levels and at the community level that have this expertise and have this knowledge and that have conducted projects that have very, very specific outputs and outcomes that can definitely fit into this process, which is very, very important. So the first thing to note here is that, I mean, the consultation is open to everyone. It's and there are different ways that people can get involved. So to reflect and include the priorities of these diverse populations, I mean, there are different ways to do so. So that's in terms of designing the strategy. But obviously, the next challenge is how this strategy is implemented, because even if the priorities are reflected in on paper, country ownership of this strategy will be critical to actually address the needs of this marginalized population, specifically talking about marginalized youth within countries. So in this second phase of the process, it's also very important that organizations working within countries participate and also embrace this strategy as an important tool for advocacy and for accountability, for monitoring, and for evaluation. So those are two things that we really need to consider. Obviously, when we think about the different contexts that organizations face in their countries, in some countries we see that there's a much more collaborative approach to the health issues affecting the youth population in these countries. In other countries, it's being a little bit more difficult. But as we embrace this as a collective effort, and we really use the tools that are being provided by this strategy, I think it will be easier to address. But definitely, it's not an easy task. And obviously there's a responsibility from both sides, like people participating and really pointing out what needs to be included in the strategy, and that's a responsibility of the people that are actually developing the strategy and people that are helping to highlight these priorities. But again, it comes back to the country level and the advocacy that different organizations make to push their governments to commit to this strategy, to this broad framework to address different issues, and also hold them accountable for those commitments.
Thank you, Cecilia. Laura, do you want to also speak to that question?
Yeah, perhaps to announce something that is very exciting that I didn't mention before. It is that in South Africa, the 6th and 7th of May, there will be a consultation with the African-based organizations, governments, but also young people. And this is a great opportunity to really see whether young people from more excluded backgrounds could be supported to come to this consultation. And we will make that effort so that this could happen. 6th and 7th of May in Johannesburg.
Laura, that's great and really exciting that will be another opportunity for young people and their voices to be heard, specifically maybe some marginalized groups as well. Elizabeth, are there any more questions from social media at this time?
Yes, okay. So we have at stpope84. She asks, how can adolescents and government or community leaders help to prevent FHM in young people? So again, let me repeat that. How can adolescents and government or community leaders help prevent FHM, female genital mutilation, in young people?
Patrick, do you want to take that question?
Yeah, I didn't get it well, but I think it has something to do with female genital mutilation, right? Yes.
Yes. Let me repeat that. Oh. Do you want me to repeat the question?
Please go ahead.
Okay. So how can adolescents and government or community leaders help prevent female genital mutilation?
All right. So, well, FGM, or female genital mutilation, is actually a common practice, especially in Africa. For example, in my country, we still have tribes that culturally or traditionally believe in female genital mutilation, but there have been very, very great strides to averting it, to abolishing it. And seriously, it's been a combined effort by the government, by the communities, and by the development partners like UNICEF, UNFP, and others. But I think it's of course, community plays a very, very great role, especially when they understand what are the dangers of female genital mutilation. I think that is what we need to start with. Do a lot of massive sensitization and awareness to the communities about the dangers of female genital mutilation, and then the government now can come in by putting in place the laws. The decision makers or policy makers must put in place laws that are towards abolishing the practice, and then the government can be held accountable to implementation of those laws. And I think the best people to do that are the young people, in particular in those different countries, like follow up and hold government accountable to their commitment to ending female genital mutilation. But also, I think very, very importantly is the communities, working together with communities, helping them to understand what are the dangers of female genital mutilation, engaging them actually in advocating against it. Yeah. So but community is big. You probably need to bring together different groups of community, the community leaders, maybe the religious leaders, the cultural leaders, the local leaders, like the local council leaders, and each of them has particular interests. You have to meet their interests as you help them to understand the dangers, and then with time, that is how we've been able to make great strides in Uganda. And it is a very, very successful. It is actually a very, very successful story. We see those old the women who used to do that, even submitting their knives. They bring the knives to the police and say, we're not doing this anymore, even when they're not being forced, because they have understood the dangers of a practice. Yeah, probably that's what I can say.
Patrick, thank you so much for answering that question, and such a good example of how communities are coming together against that issue in your country and in your area. Again, thank you so much for the live questions. Continue to follow along via Commit to Deliver and ask your questions, as we'll be taking more a little bit later on in this Hangout. I want to move to start talking a little bit about some challenges, and this question is for Cecilia and for Patrick. In your experience, what has been some of the biggest challenges for young people in accessing essential health services, and what are some of the success stories as well? What have you seen as successes in that same regard? Cecilia, if we want to go to you.
Thank you. I want to elaborate on my first answer to the very first question of this Hangout, and to really highlight the importance of strengthening the human rights approach to this strategy, and not only to this strategy, but all the things we do back in the countries and in these discussions about the post-2015 agenda. So, I mean, when we talk about young people in general, we really need to understand that depending on the age of those young people, we are facing different challenges. And I really want to focus on the adolescent population, because when talking about adolescents, we're talking about much more challenges that we face in the different contexts we live in. So one very important barrier and challenge, it's the legal restrictions that some like these people face to access services, which is directly linked to the like cultural understanding of and the stigma and surrounding sexuality, the adolescent sexuality. So that's something, I mean, changing that mindset and really reflecting, you know, like a more progressive approach to adolescent sexuality in policies and laws and, you know, like national strategies. It's very difficult, because you really need to fight that stigma, and also I mean, when we talk, for instance, about violence against women and violence against adolescents, I mean, Patrick was just addressing this issue of female genital mutilation, but we're also talking about forced marriage. We're also talking about rape. We are talking about many different harmful practices that are still happening nowadays. So when we talk about this and we see what's the reality of countries, we also need to link this to law enforcement. I mean, we have in countries laws and policies that are supposed, you know, to address these issues, but laws are not being enforced. So now we were talking about the commitment and what's going on with the justice system within this country. So that's another challenge we really need to address when we talk about adolescent health specifically. I mean, and again, is how to involve, obviously, the community, parents, the community leaders, and different stakeholders that are very important part of the discussions, but help them to understand that we need to respect adolescents' autonomy and decisions. So even though we involve like a diverse group of people in these discussions to think about better strategies to address the needs of adolescents and specifically their health needs, I mean, we need to find a balance in whether they have a say in what these people choose to do. Obviously, having the right information, access to services, to contraception, to education, etc. So, I mean, those are a few things we really need to be aware of, and that are very relevant to this discussion. And regarding the success stories, I would say that like having adolescents and young people participate not only in the decision making, but also in the development of the strategies, and involving them in the assessment of the strategies that we put in place. It's very, very important because they provide very like an enriching feedback to the things you're doing. And even though we are trying to prioritize the youth perspective in this, the thing is that, I mean, for instance, I'm not an adolescent anymore, and the reality changes, and the needs are evolving sometimes. So we really need to come back to these groups and involve them. It's not just consulting them and then coming back and developing the strategy and then like doing what we think is best for them. It's actually having them at the table, at the decision making, during the development of the strategies, during the implementation, and obviously during the evaluations of those strategies. Otherwise, it's kind of a tokenistic involvement of these populations, and this happens at all levels. It's not only about, for instance, the development of this strategy, but it's also about how we better involve them in our projects, on our daily activities. Yeah. So that's all.
Thanks, Cecilia. I really love your spirit and fire and your wisdom on this topic. Patrick, do you resonate with what Cecilia is saying, and maybe you want to share from your experience as well?
Yeah, I think Cecilia has really covered quite a number of the barriers that still impede young people from accessing services. I'm glad he mentioned one very, very critical point on violence, which is still predominantly evident in our communities. But most importantly is the question of confidentiality, like especially among public health facilities, because you see in our countries, like personally where I come from in Uganda and many other countries like Malawi, Botswana and others, you find most of the biggest part of the population depends entirely on the public health facilities, because the services are slightly cheaper, slightly affordable, and slightly accessible, but not really very accessible. So you find that confidentiality is not there. Like, let me just give you an example. You find we have an ART clinic, and maybe my parents are living with HIV, or my teacher is living with HIV, and I am living with HIV. I don't want my teacher to know that I'm living with HIV, because I'm not sure whether he will not go and tell the whole class. And so you're all getting treatment from this same facility, and you go and you find yourself in the same line, in the same queuing up to pick treatment. And trust me, when this adolescent comes there like this and sees the teacher, they're not going to go back. So the question of confidentiality is still a very huge challenge. Then the attitude of health workers, I think I'd already addressed it. And at times I don't blame these health workers, because I think they're just not trained on how to directly deal with adolescents. And I think this is something that UNFPA really, really needs to take up, because I know UNFPA is supporting a lot of encouraging young people to go and study to be midwives, and supporting Ministry of Health in different countries to do for health workers to do refresher courses and all that. I think it's very, very critical that they look into the issue of attitude of health workers and training health workers to provide that, to have that youth-friendly service nature in them. I think the other critical point is there are two things. There's accessibility to youth-friendly services, and there's availability to youth-friendly services. But the truth of the matter is that they are not even available. If I'm to quote from the Uganda Demographic Health Survey of 2011, which is the latest, provision of youth-friendly service was rated at 5%, and this is inclusive of private and government. You see, most of our governments, IPPF probably has different, I don't know what, like branches in different countries, and they're providing these services, but they cannot go viral and go wide to different, like to reach out to many parts of the country. So these services are not there. I think we need to first and foremost look at how do we influence the health sector budgets in our countries to have at least it could be a standalone budget for instituting youth corners at public health facilities and also making them functional, or it can be, a certain amount of the health sector budget, just like you know, in the budget you have money for family planning, in the budget you have money for child health, maybe nutrition and other programs. I think it's very, very important, because these people in the health sector will tell you we don't have money for adolescent health. I think it is critical that we make sure that these services are available, because they are not available. They are not available. Like in my country, they are not available, and I'm saying this openly to the whole world, that they are not available, because even the national documents have rated them at 5%, including private and public. Then issues of language also are critical, because at times you find that there's some very, very nice literature that you find, toolkits you find designed by Women Deliver, Restless Development, IPPF, Ministry of Health, whatever, but they're in English, and we have, like in most of the developing countries, you find not everyone knows how to speak English, so it becomes very hard, and probably we need to understand that young people lately are not so much into a lot of reading. Probably we need to devise strategies of how do we reach out to them in a different way. How do we use the social media? How do we use infographics, you know, which they can easily share on WhatsApp and share videos and they go viral. So probably that is another thing. Then I'm glad Cecilia talked about meaningful involvement, especially in designing of programs. I think that is very, very key, and it's something that we're trying to pursue and push in my country. Anything for us, we must be in it. If we are not in it, then it's not for us. And I think young people in other countries should also take on the same agenda. And of course, families are also not all that supportive. And I think it's a critical point. Parents, and this is something that probably the global strategy needs to look into. Like for example, if we're providing a maternal health package to a mother who has come for antenatal, how do we engage the mother, especially if she's a mother of maybe 3, 4, 5, or a mother of 3 or 2 or whatever? How do we also engage them? You know, ask a question on how do they relate with their children when it comes to issues of sexuality education? Do they engage them? You know, because some families have completely abandoned their children, their adolescents, to find out for themselves, and which of course is a bit risky. So I think those are some of the barriers, of course, transport and other things, but those are some of the barriers. Thanks so much.
Thank you, Patrick. I think we have seen that the challenges are very real, but I think the opportunities are there as well. And I want to turn it over to Laura to ask you to speak into this. And how do you think global leaders and governments can really put words into action for adolescent health? Can you share some success stories and maybe speak into what Patrick and Cecilia are talking about?
Yeah, with pleasure. I think that there is increasingly in the last, I would say, 5 years, that governments, important governments of big countries have taken action in the South to build programs at scale, meaning that they are national programs that are in every corner of a country. I would like to give the example now of India, that they have launched a adolescent health strategy in January of 2013, and actually that strategy has been now with the new government. They are developing the plans for implementing that strategy. You can imagine India has 253 million adolescents, people between the ages of 10 to 19. And so what is going to happen there, the strategy was developed with a lot of involvement of young people. So now they are trying to see whether they put funds on implementing that. The other example I want to give you is the example of Argentina. It is my country, but it is a very innovative plan that is called Program Sumar. And that Program Sumar has included adolescents in the last 3 years. And so the health teams in the primary health care levels in the primary health care centers, they go and try to reach out to adolescents who they think, are marginalized, don't have access, etc., etc. So they invite them to come for a checkup, or they invite them to, they give them information about the services. And this is happening across all the country. Then you have a country like South Africa, where in South Africa, the government has supported an NGO, the Love Life, and has built that program across the country, in some parts of the country, but in the most marginalized parts. And now they realize that there is another time, the program was developed because of the HIV infection, but they want to add other services. They have added other services, but they want to really renew and see how they can improve that adolescent health strategy, and so they are working on a new one. So there are many examples. It is difficult to find examples that are at scale, that serve every single adolescent. And I agree with most of what Cecilia and Patrick have said about the question of accessing services and using services. They have many, many challenges, and I fully agree with them about the importance of training the healthcare providers on being, providing services that are of quality, confidential, and non-judgmental. And this is part of things that we will include in the adolescent health as a part of the global strategy.
Laura, thanks so much for sharing those great examples and for sharing your perspective and expertise in this as well. I think we're have some burning questions from the audience, so I'm going to turn it back over to Elizabeth for some questions from our live audience.
Sure. Thanks, Diane. We have at J. Cornell Cares. She asks, where are the greatest opportunities for youth engagement in the post-2015 strategy? Again, let me repeat that. Where are the greatest opportunities for youth engagement in the post-2015 strategy?
Cecilia, do you want to start off with that question?
Yeah, it's a difficult question. Well, since we are right now discussing the update of this global strategy, and as this global strategy is obviously linked to that broader process, I would encourage young people to really get involved and really, make the youth voices, sound stronger in this strategy. I mean, I think that's why we're doing this hangout, and there are other activities that are going to happen. And please feel free to ask, and we will share this information on how can you get involved. There are going to be citizen hearings. There's a hub. There's a survey. I mean, there are different things that we can do. And I mean, this strategy is health specific to very, very particular populations. So I think this is a great opportunity to actually not only advocate for these cases, but have this put together all this ideas and give them the strength they need to be very visible in the strategy, and obviously in the implementation plan that is coming after the strategy is designed. So I mean, and it applies to the different processes. I mean, it's very, very complex to get involved in the post-2015 discussions, but because we can have meetings with the Ministry of Foreign Affairs in our countries, or we can develop joint statements from organizations. That's very, very helpful, because even though we're not sitting at the negotiation table with the state members, we can do things back in our country to help them understand what is happening besides those discussions that they're having in New York that are very, very well, that are close to civil society in general. So there are different things that we can do, and that have been done. For instance, I went to just to bring this example to the discussion, and what happened during the CSW and what was the response of the civil society organization to the political declaration of the CSW this year. And I think that's a good example of what can we do. I mean, there are ways to have information and to share that information of what's going on at this level, and then we can you know, like, react to those things if we think they're not actually addressing the important issues that we see and we know that need to be addressed, not only in the post 2015 agenda, but in terms of the policies that are being developed in our countries and the budget that is being allocated. As Patrick mentioned, budgeting within countries, like domestic budgeting, is very, very important. So yeah, I would say there's not a simple way, but it's really important to identify what are these other processes that are happening, you know, like you know, alongside with the discussions back in New York, that can become an opportunity to impact those discussions and to have a, you know, like a substantial content that will help policymakers in our countries actually address these issues. Yeah.
Thank you, Cecilia. Laura, do you want to speak into that question at all? What can youth do in the post-2015 agenda?
Sorry, I was thinking that the question was going to Patrick. The Secretary General has named a special envoy on youth issues, and he has, with many other agencies, UN agencies and civil society organizations, sort of rally a group for including the voices of young people in the post-2015 agenda. There have been discussions in the countries, there have been discussions in, you know, regional meetings and regional fora, through internet, through, you know, Hangouts, Google Hangouts. There have been a lot of opportunities to make the voices of young people heard. Now the time is closing in terms of how to influence the agenda itself. The governments may have agreed. We have the great news that they may have agreed already on the goals and on the targets. They are discussing now the indicators. So now it's the time to influence those indicators, and it will be great to reach out to your local organization of young people. I'm sure they are connected to really mobilize around what exactly they want to see reflected, that will improve and will affect and will make the health, but also not just the health, the knowledge, the skills, and the opportunities for young people to have a healthy life, and a life that in which they can enjoy all the human rights.
Great, thank you, Laura. I'm going to pass it back over to Elizabeth to ask one more question from our audience.
Thanks, Diane. The last question is from @JuneEricUdori, and her question is, what can we do to ensure that when girls speak up, their voices are recognized and not attacked? So again, the question is, what can we do to ensure that when girls speak up, their voices are recognized and not attacked?
Hi. I don't know if Patrick wants to go first on this question. I don't know.
Cecilia, maybe you can take the question first, and then Patrick.
Okay. Well, I'm not sure I have the answer to that question, because obviously it's very, I mean, it goes back to those what. And sorry, I'm going to put this. I'm not sorry. It's just like the feminist movements have, you know, like made like major progress in this sense, and they're very. I mean, and they're very clear on what we need to do just to ensure that this. These girls and women are safe not only when they speak up, but when they participate, when they exercise their rights, when they access services, when they approach institutions. So I mean, there's no, I don't think there's one answer to this question. I think that I would take this back to our own responsibility as individuals, but also as society, on how we make this our cause as well. It's not just like saying, yes, I mean, girls should speak up. It's great what Malala did, or you know, all these people and leaders that we have in mind and that have you know, like challenged the status quo and you know, like saying what other people don't want to hear, and especially you know, governments, decision makers, religious leaders that put their lives at risk also. So I think it's about like how we support those voices. I mean, we have to give them the you know, like the space to say what they need to say, but we also need to understand that it's our responsibility as society to back up those voices. I mean, it's not just like, yeah, that's their fight, that's their you know, that's what women need to do, or that's what young people need to do. I mean, they need to fight for their rights, and just like, you know, asking them or us women to do that without you know, other people, young men, politicians committing to those efforts, it's not possible. I mean, that's if we think, for instance, about this campaign that was launched by the UN, he for she. I mean, I think that very short phrase like really reflects what I'm saying. I mean, it's everybody's responsibility, and it's everybody's benefit. I mean, if women and young people are able to exercise their rights and if we achieve gender equality, for instance, that would benefit us all. So understanding that is critical to make sure that when people are out there speaking out and you know, like demanding access to their rights, they are not at risk, but really supported by their communities and the society and governments and the international community as well.
Thank you, Cecilia. Patrick, do you want to add anything to that?
That is a very critical question, and definitely I would be glad to answer. I think it's very, very important for young people to understand that they have a voice, and their voice is critical and is very, very important, and that it can also meaningfully input in whatever that is being discussed. Actually, I like someone who has asked that question, because oftentimes, and it happens a lot, especially in developing countries, where we still have you know, cultural and traditional beliefs that women are not supposed to talk. Maybe when men are talking, women are not supposed to, you know, input into discussions that are pertinent to maybe development and other things, and so I actually see where the person who asked that question I see the background of where she's coming from. It's critical. One, women must be empowered. They must know about their rights, and it is our role as, you know, as families. It's our role as, and actually this is something that should even come out in schools. You know, young women to be taught about their rights, their freedoms, their, you know, so they are confident in society. They can bring out their issues. They can challenge those who want to, you know, take advantage of them. And but also very, very importantly is that every time young people engage in discussions, they need to have taken time to, like to research, to understand that at the end of the day, when they are engaging in these discussions, they are informed of what they are saying, they're in line with what is being discussed. But there's absolutely no doubt that young women have a voice, and their voices must be respected, their views must be respected, because they are the most vulnerable, the world's major problems. So definitely, if you don't give them an opportunity to speak out and be heard, then it is a challenge. But we must empower them. They must be empowered with information. They must be empowered economically, and actually that relates to health. And we need to start looking for all possible ways of striking a joint approach between health and economics, or health and livelihood. Because when they are empowered economically, when they have incomes they bring in, when they don't depend on men, they stand confidently, they stand independently and make decisions. Then I think it's very, very critical. So we must put at the core of our business young women. We must put at the core of our business empowering young women with information on their rights, so that they can. It is their voices that will challenge people who oppress them. It is their voices that will challenge governments that will actually make governments accountable to their commitment of protecting the rights, of protecting the views of women. Yeah, that's probably what I can say. But it's entirely very, very. And I would like to encourage young women, before I finish, that back in our countries we have ministries. Like, for example, in my country I have a Ministry of Gender, Labor and Social Development, where issues of women are entirely discussed. You can approach those ministries. There are committees there are sections and departments, there are commissioners and directors who are directly responsible for issues of gender and women. We have you go online, there are very many opportunities, very many spaces that you can bring out your voice. Some of the leaders are very friendly. Some of the leaders want to give opportunities to young people. So young women also can utilize those spaces, even at community level, through community leaders, through non-government organizations that are doing work in their communities, to bring their voices out. They can form groups and speak as a group. At times, it's very important, and it makes more sense when you speak when you're a joint group, when you speak as a joint voice as opposed to one voice. So I think we need to learn the dynamics of how our voices can effectively be heard. Yeah.
Thank you so much, Patrick. I think that is a great note to end on. I love what both you and Cecilia have said, and Laura as well, that this isn't just a conversation for one group, but that we all need to be involved in the conversation. There are different ways that all of us can be involved in improving the lives and health of adolescents. I want to just encourage those watching that you can go to a website, womenchildrenpost2015.org, where you can actually participate in this conversation further, because it's not over. And there are several ways, as Cecilia mentioned, you can be involved through live commenting on a comment wall, sharing your ideas and your thoughts. You can also, by March 20th, you can take a survey which allows you to input and share your thoughts and ideas about how you want to see the global strategy change and what you want to see as priorities for women, children, and adolescent health. So again, that website, womenchildrenpost2015.org, where you can share your thoughts and opinions as well. I really appreciate all of you, Cecilia, Patrick, and Laura, sharing your ideas and sharing your wisdom and expertise. I think it's been a very beneficial conversation today, and appreciate you sharing your voices and being willing to take the time to do that. So thank you so much for joining us today.
Thank you, Diane.
Thank you.
Girls Globe. Thank you, Laura, Elizabeth, and Patrick.
Thank you.
Bye.
Thank